Welcome to Petgevity, the podcast that gives you the best advice to help your pets live longer, healthier lives. The other day, we were contacted by a listener called Davina. She asked us to help raise awareness of a topic that is very close to her heart. Here's her story in her own words.
Rosie is our black and tan miniature Dachshund, and she means the world to us. As dog trainers, we've worked with Dachshunds for years, so we're very aware of the health challenges that can affect the breed. Even so, nothing prepares you for the moment it happens to your own dog. In October 2024, Rosie underwent surgery for stage 2 intervertebral disc disease, also known as IVDD, which is a neurological spinal condition that can cause pain, weakness, and paralysis. Thankfully, she made a fantastic recovery. Over the following months, she returned to her normal self. She was happy, active, and enjoying life again. Then in August 2025, everything changed. I remember waking up that Sunday morning and realizing she couldn't walk. One day she was absolutely fine, and the next she had lost the use of her back legs. It was terrifying. We rushed her to the out-of-hours vet, who immediately referred her back to the Veterinary Specialists in Cambridge. Rosie was taken straight for an MRI and then emergency surgery. The days that followed were incredibly difficult. We were told that she still had deep pain sensation, which gave us hope, but there was no obvious movement from the waist down, and she had lost control of her bladder and bowel. Even though we'd been through the process before, when it's your own dog, you don't think clearly. You're frightened, emotional, exhausted, and focused entirely on getting them through the next hour, let alone the next week. Her recovery wasn't straightforward. Along the way, she developed urinary tract infections that required additional treatment and medication, resulting in further veterinary costs. Recovery from IVDD can be a long road, and there were times when progress felt painfully slow. For weeks, we saw very little change. Then came the first tiny signs: a twitch of her tail, movement in her toes, and gradually the return of bladder and bowel control. To anyone else, those might seem like small things, but to us they felt huge. After several months of crate rest and regular reviews with the specialists, Rosie was finally cleared to begin physiotherapy and hydrotherapy closer to home. She still attends weekly sessions now. The reality is that modern veterinary medicine can do incredible things, but those treatments come at a cost. Without being prepared, owners could find themselves facing impossible decisions during what is already one of the most stressful periods of their lives. Today, Rosie continues to make progress, and we're incredibly grateful for every step forward she takes. In our work as dog trainers, we spend a lot of time educating owners about canine health, welfare, behaviour, and responsible ownership. If there's one message we'd like people to take away from Rosie's story, it's this: be prepared before you need to be.
Today I'm joined by Dr. Mark Lowrie, an internationally recognised neurologist and director of Veterinary Specialists Movement Referrals. Together we'll discuss what IVDD is, how it's treated, and the key information every dog owner should know. Hello, Mark. Welcome to the Petgevity podcast.
Hi there, Fabian. Thanks for having me.
We're going to start with some quickfire questions, and I would like you to give just yes or no answers. Can early detection of IVDD help prevent paralysis?
Yes.
Can changes in a dog's behaviour indicate IVDD?
Yes.
Are there treatments for IVDD that don't involve surgery?
Yes.
And you can have your full sentence now. What is the biggest misconception about IVDD in dogs?
Well, IVDD, it's not just a slip disc. It's a whole spinal cord story, I guess, and every dog tells it slightly differently.
Really important for people to understand that. So that's great. We heard about Davina's first-hand experience of caring for a dog with IVDD. It is obviously a very difficult and distressing condition for both pets and owners, and therefore it's really important to understand it better and help people be as prepared as they can possibly be. So let's start with the basics. What is IVDD?
Yeah, I mean, great question. So IVDD stands for Intervertebral Disc Disease. And most owners probably know it by a much simpler phrase, a slip disc. And when I explain it, I often describe the disc as a bit like a jam donut. So the tough outer part of the donut is called the annulus fibrosus. I think of it as like a thick ligament. And then the jam in the middle is the nucleus pulposus. So in a young, healthy disc, that centre's nice and soft, hydrated, and beautifully designed to absorb force. But in many dogs, and especially breeds such as Dachshunds, French Bulldogs, I mean, I could list a number, that jam donut quietly changes, usually in the first couple of years of life. The centre dries out, it degenerates, and it may actually mineralise, so become calcified. And it becomes less like a soft jam and more like a gritty paste under pressure. And that's the important point, really, because IVDD is a really silent disease until it suddenly isn't. And a dog may look completely normal in the morning, but the biology of the disc may have been changing for months or even years, and the crisis looks sudden, but that disc problem has really been starting much, much earlier than that. And I guess the classic form for most owners that we recognise is type 1 IVDD. So that's where it's like a jam donut blowout, if you like. The outer ligament tears and some of the degenerate jam shoots upwards into the vertebral canal and goes straight towards the spinal cord. And the problem with the spinal cord is it lives in this bony tunnel. So it's not sitting in a spacious room with plenty of give, a bit like we are now. It's really under a lot of pressure there. So when the disc material suddenly enters that tunnel, the spinal cord almost has nowhere to go.
So I'm going to look at jam donuts very differently from now on.
We always get a bit hungry doing this.
But it's a really apt way of explaining something that's quite hard to visualize for many people. So what are the typical symptoms that you see with IVDD?
Yeah, I mean, they're mixed, very mixed. Starting at the beginning, I mean, the first sign of IVDD is often pain, not paralysis. And pain in dogs can be really subtle. Sometimes IVDD can simply be a dog that maybe intermittently yelps when lifted. Maybe they avoid stairs or jumping. They walk hunched. They might tremble or just seem really quiet and off a bit. I mean, actually, sometimes it may look a bit like a tummy problem. You see dogs come in that are a bit off colour and you think, they might have quite a stiff tummy because the muscles are all spasming away. There's a lot of pain and they just look like a dog with stomach pain. But a dog that suddenly refuses to jump or it's not necessarily being stubborn. You know, they may actually be protecting their spine, as we very much would. I mean, think about our own behaviours. And I guess we can think about how we behave when we have back pain. We move carefully, we avoid bending, we don't want to be lifted or twisted, and dogs are exactly the same. They just cannot say, my back hurts and I don't want to move. But what happens as that jam leaks out, if things were to worsen, the spinal cord then becomes more affected, and owners might notice this wobbliness. I don't like that term. I like the word drunk. Dogs look drunk when this happens. The back legs kind of cross, the claws may scuff on the pavement or on hard floors. They may even knuckle over. You might actually see the paws knuckling over. So the dog may seem weak and clumsy or kind of disconnected from the back end, and that's often as the signs start to progress. But then in more serious cases, the dog may be unable to walk, not able to stand, and could even develop sort of bladder and potentially bowel problems, so incontinence. And I guess the message I'd give is the simple basis here is pain's kind of the initial warning. The wobbliness or the drunkenness is like a red flag. But if you've got a dog that's not walking, then that's much more of an emergency.
Speaking of those presentations, though, how common is it? How common is IVDD?
You can look at it by breed, because there are certainly breeds where it's much higher risk. And we talk about the chondrodystrophic breeds, effectively the dwarf breeds, if you like. A Dachshund is your classic example. So I'll probably be guilty of mentioning Dachshunds lots today. And I own one, so I'm allowed to do that. But Dachshunds they're effectively dwarf Labradors, I guess, is one way of putting them. They're Labradors that are stunted in how they are. And because of all the genetics, and there's so much we could talk about later, they're stunted and their discs are more prone to slipping. And in Dachshunds, I mean, I've heard figures as high as sort of 30% of Dachshunds can suffer with some form of IVDD over their lifetimes. And I guess that then sort of really drills it home that it is a very common problem in breeds that are affected by this condition.
Is IVDD risk strongly influenced by genetics, or is it a bit of a mixed bag?
Great question. So one of the biggest advances in IVDD over the last decade has been our understanding of the genetics. And we know that many of the breeds we associate with slip discs are not simply unlucky. They're born with discs that are programmed to age too quickly. So I know scientists have identified important genes. There's one called FGF4, and it's strongly linked to the short-legged appearance of breeds like the Dachshund and French Bulldog. And those breeds are the ones that are sort of at risk of premature disc degeneration. Now, if one gene explained everything here, we'd have solved IVDD years ago. There are plenty of really good success stories in the veterinary world where one gene was causing the problem and it's gone. The disease is in history, which is fantastic. But there's clearly a lot more discs. And this FGF4, I mean, if you have a Dachshund and you were to test for it, I could almost guarantee you would find you've got that genetic mutation because you are a Dachshund and that's how you look. So it's not as simple as breeding out that, because if we do that, we have to breed out, so it's what we call a fixed trait. Every Dachshund has that genetic mutation. We need to breed out of the Dachshund world to try and avoid it. So it's not that simple. So IVDD is a combination of several different genes, which probably influence body shape, disc biology, and probably loads of environmental influences too. So you do get Dachshunds that live to 15 without ever slipping a disc. But then others are only affected at ages 2 or 3. And so definitely genetics is a huge, huge factor here.
In Davina's case, in her story, she took her dog to the vet and decided to go ahead with surgery. Now, you're best placed to share with us about what that looks like. What does the surgery involve, or what is the surgery?
The most compelling reason for performing surgery in a dog with IVDD is a dog that can't walk when the clinical signs are maybe really severe, or maybe they're deteriorating quite rapidly. These things can come on really quickly, or when pain's not controlled and you've got a dog that's in a lot of pain despite everything that's going on. Now, in surgery, what we're doing is we're trying to remove the jam that's pressing on the spinal cord. So we take the jam out, we take the pressure away, and we're basically giving the spinal cord the best possible environment to recover. But I think it's really, really important to say surgery is not some magic reset button. Surgery can remove the jam, but it can't unbruise the spinal cord. It also can't repair that donut ligament, if you like, that's ruptured. And this is one of the most important owner messages, I think, in IVDD, because the operation can be technically excellent. It could be the best IVD surgery that's ever been performed. But, removing that compression, brilliant. But the spinal cord still has to recover from the impact, the swelling, the inflammation, and the kind of biological aftermath of that injury. And even the best surgeons have no ability to repair that. That's with the dog's spinal cord. That's all we can hope for. So I think it's important to say when we look at surgery, that's what we're doing. And it's why when dogs have surgery, it's always essential to keep a dog fairly rested afterwards. And the rationale I give for this, there's a number of reasons, but one of them is to allow that ligament to heal so more of the jam that might be left behind in the disc doesn't leak out and cause problems days, weeks, heaven forbid, months later. I suppose what I'd say, though, is with surgery, the other thing that's really good is the relapse rate of IVDD is much lower if we perform surgery. So I usually say it's 10%, maybe less than that. Whereas if we perform other techniques, maybe that relapse rate is slightly higher.
Are there things you can do to reduce the chance of reoccurrence?
It's a very interesting question because I can't give a straight answer, yes or no. We don't know enough about this disease. And I immediately go back to people because I think in people, a lot has changed in over the years. I mean, even since I started learning about this disease, there was definitely a time when we were told with slip discs to kind of stay rested, lie in bed, don't move, and that kind of thing. Nowadays, we're told to do Pilates and keep active and keep a strong core and this kind of thing. So you can see how the advice with people has changed dramatically in quite a short space of time. Therefore, I don't think you'll ever find someone who can say this is truly what we need to do for dogs with IVD and in recovery. I think there are certain things we know definitely do help. And the first one I'd say is physiotherapy. If you perform physiotherapy with your dog, ideally get guided physiotherapy with someone qualified in performing veterinary physiotherapy. That is enormously helpful. And I think very few people would question that that's ever going to cause harm. I think that's always positive. And I want to start that right from the moment the surgery is done. Because there are different types of physiotherapy. I'm not talking about physio where you're kind of running around a field. There's sort of that's the active stuff. I like the passive stuff as well, where you're literally getting massage and basic things to keep tone. Because we all know if we sit in a bed for 6 weeks and don't move, you're going to be a lot less fit at the end of that 6 weeks than if you'd have done some kind of activities to keep your muscle tone up. So physiotherapy for me is a big, big one. But then there are other treatments. I mean, it depends whether we're talking about dogs that have undergone surgery or not. That you may hear people talk about a technique called fenestration. Now, fenestration is something we do actually at the time of surgery. And it's where we go into the jam donut of the disc and we remove the jam that hasn't yet leaked out of the disc. So we usually do this at the affected disc site. We remove that jam. And it's almost like a poor man's insurance policy to stop that jam from ever leaking out again in the future. And if on the imaging, if on the MRI scan, we find the neighbouring discs also appear to have degenerated, so they're calcified, we can fenestrate those discs as well. So that can be a useful thing, but I'll tell you now, it's a very difficult procedure to perform well. And what I mean by that is even the very best surgeons will do this and realise they do leave a huge amount of jam behind. So it's not the best solution in the world, but it's definitely something to do that will hopefully try and help. But the other things we can do, I mean, there's actually a recent study. I mean, one of the most exciting emerging ideas for me in IVDD is there's an injection called, I've got to say this right, chondroitinase ABC. So the simplest way to explain this is instead of surgically opening the spine and removing disc material, a needle's actually placed into the disc itself, into the jam, and an enzyme is injected. Now that enzyme chemically breaks down the hardened jam, the disc nucleus, the jam in the middle of the donut. And it's like a form of chemical castration. Now, traditional fenestration physically removes the jam from the selected disc to reduce the risk of future extrusion during surgery, but chondroitinase tries to achieve something similar with an injection. But I'd want to be really clear on this. It's not the same as decompressive surgery. You know, it doesn't go into the vertebral canal and remove the jam that's already pressing on the spinal cord. So if a dog's got a really severe spinal cord compression, you clearly need to go in and perform surgery. And I'd not really present this injection as a replacement for MRI-guided surgery. But where it becomes really interesting is that it may actually have two roles. I mean, so yes, it could work in treatment of selected dogs with acute type 1 IVDD, particularly small dogs that are suddenly unable to walk, but still have some kind of movement or feeling in their back legs. Importantly, the evidence for that at the minute is poor, but there are studies going on right now at Cambridge University. They're doing studies into this. But the second, and perhaps for me more convincingly, it may actually act as a preventative treatment by chemically weakening or emptying several high-risk discs. It may actually reduce the chance for another disc extrusion later on. So it's one of the most exciting developments for a while. It may offer a minimally invasive way to chemically stabilise high-risk discs and reduce future episodes, but promising is not the same as proven. Yeah. And I think more studies need to be done to see where we're actually at with that treatment.
Well, it's nice to see that things are developing, and you know, it's also really interesting from even a clinician's perspective that, you know, what my understanding of how these things can develop and how to treat them is changing so quickly. So it'll be really good to see if there are minimally invasive ways to approach this, and that's really, really, really exciting. I'm sure it's really exciting for you. With regards to reoccurrence, how should an owner adapt their home for their dog post-surgery? Like how would they do that?
Yeah, so in the immediate aftermath of surgery, we're looking at up to sort of 6 weeks of very strict rest. And we talk about crate rest, but I mean, crate rest is fairly inhumane. I don't want people to be putting their dogs in a crate and ignoring them, and I don't think no one wants to do that. So initially, we strictly rest a dog in a crate, but I would say if you've got time at home, if you can sit with your dog at home, if you work from home, fantastic. I love it when owners say we work from home, because they can sit with their dogs while they're working, while they're on their video conferences and all their calls, and the dog can be there and it can still feel part of the family. I think that's so, so important. But it's those times when they can't be with the dog that they need to keep them strictly rested. Now, once we've got out of that period and the dog starts to show good signs of recovery and is moving around well, this is when it's a bit more difficult to give exact guidance on what we should do. And I definitely have my belief that I think these dogs should be allowed to be active. The one exception to that is the dogs that weren't active before. So I'm not trying to get dogs that maybe weren't the most active to become Olympic athletes. But if they were active dogs, I would fully encourage getting back to that stage. Obviously, with physiotherapy guidance, I think that's enormously helpful. But to allow them to gain strength and move around. And I am going with what the human evidence shows now, that, we need to do Pilates. I haven't seen a Dachshund do Pilates, but I think similar activities, strengthening that long back, is really important. And it's anecdotal, but I know people who have had Dachshunds that maybe have suffered with them having 2, heaven forbid 3 or more surgeries. And they then live in fear and they carry their dog everywhere and don't let the dog walk. But I actually think they're inadvertently making that problem worse, because that dog is losing fitness, is losing the core, and it's making a disc problem more likely in the future. So long term, I personally would say get your dog back to normal. Don't adapt your home too heavily. People use ramps up to the sofas and things like that. Now, I'm fine with that, particularly with small breeds like Dachshunds that maybe struggle to jump up. That's okay. But if this was a bigger dog, if they're able to jump up onto the sofa quite easily, then and provided they're allowed to do it, then that's fine. They can do that without any problem at all.
I think after this, I'm going to put a patent in for dog Pilates. So just so if anyone knows.
Please, I'll bring my dogs. Yeah, you've got one customer already.
But I think it's really nice. And there's one thing that I've been learning through all these conversations is that there's a huge amount of crossover between the human field and, other mammalian fields, if we're being very broad about it, because essentially at very base, we're very, very similar, a lot more similar than we are different. And the surgery itself obviously has a high technical involvement. Is the surgery expensive?
Yeah, well, I think the answer is yes, it is. When we talk about surgery, we need to perform some form of imaging initially. So it's not a case of you take your Dachshund to the vets and we go, right, we're going to operate, and we go straight into our operating theatre. Because once we've examined a dog and we think IVDD is a possibility, the next question is, how do we confirm the diagnosis? And many owners will quite reasonably ask whether an X-ray will show a slipped disc. Unfortunately, the answer is usually no. I've said the spinal cord sits in this tunnel of bone. Standard X-rays are really good at showing bone, but they cannot show the spinal cord itself as it's hidden away in that tunnel. So, an X-ray may show that we've got a slightly narrowed disc space where the bones have come together when the jam's escaped. It might show a calcified disc, but really an X-ray cannot tell us what we need to know with this problem. So an X-ray is not any good. And that's why MRI has become the tool we tend to use, the gold standard, I guess, for diagnosing IVDD. And MRI allows us to see the spinal cord itself. We can see where the disc is ruptured, how much compression's present. But just as importantly, we can also see what effect that injury has had on the spinal cord itself. So what we're paying for with this is we're paying for that scan, which is an expensive procedure. And an MRI scan, a dog has to be under general anaesthetic to stay still. Once we've confirmed the disc, we then go on and perform surgery. So it is a good few £1,000s, depending on where you go. And different centres have different costs. You have different vets performing the surgery. And I think that's really important to say. You can get vets like myself, and we're specialist vets who are trained, who have done this. We do it regularly and that kind of thing. But you also get vets who are advanced practitioners who are equally very good surgeons and will be able to perform this surgery. And it's not as expensive when they do it. So there's different tiers of vet that can perform this, which can alter the cost of the surgery.
Can dogs make a full recovery after surgery?
I'm going to say yes, but I think there's always a but, isn't there? So when we're performing surgery and we're doing this, we usually say dogs will get back to normal. And normal would be running around, having a great life. The reality, if we actually do look at dogs that maybe have had spinal surgery some years previously that have gone on to recover, it may be they're never exactly the same as they were before. I think there is a chance of slight wobbliness in the legs, not being quite as strong. The risk of incontinence is always there. Maybe that the way a dog urinates changes slightly. So I always say they get back to a good quality of life. Can I promise they'll be back to a normal, the same quality of life? Then I think that's a little bit more guided. And it's partly our fault, I'll be honest, as surgeons, that we've got a very crude measure of we've got a dog that's not walking and we want to get the dog walking. Now, we tick that box really well, but to an owner who lives with this dog and likes going for a walk in the Peak District up hills and things, that might not be enough. And it may be they never quite get back to the full health that they wanted. But if dogs are mildly affected, they've got a much stronger chance of getting back to normal than those much more severely affected dogs where they're paralysed.
So how important is it to catch this condition early?
That is the key for a lot of this. Now, early can be the case that you've just got a dog that's a bit off colour and not quite right and not moving around well. Now, for me, that's a really key time to be doing what we need to help these dogs. Conservative management is probably something I'd want to cover here, that when you have a dog that's mildly affected, we've talked lots about surgery. There's a huge part here where conservative management is a very sensible thing to be doing. And that is effectively doing what you do in the aftermath of surgery, which is, we've talked about crate rest, but keeping a dog restricted, doing physiotherapy, still incredibly important, and helping that dog whilst it's painful. Now, we definitely need to give pain medication to that dog. I'm a massive advocate. Any dog in discomfort, we give analgesia to control that pain. However, as we know, if we take pain relief when we've got bad backs and we've been told to rest, you take the medication, hopefully you feel a bit better, you start getting up, you start moving around, you're doing a lot more in terms of activity, and before you know it, you've caused more damage to yourself. So the difficulty with dogs is we really struggle to tell them what they need to do. They'll just think, why have you shoved me in this crate? That's awful. But if you actually give medication and they stay rested, fantastic. But if they start to move around, cutting back on that medication might be a good idea to allow them to kind of rest. And it's very possible. I mean, actually, when you've got dogs that have pain alone, the stats show that they do just as well with rest as they do with surgery. So a dog with only pain as the problem has a very good chance of recovery with rest alone. So it's a very, very important thing to do. And that's why catching it early is good. And the big trap for most people is they will rest their dog because they're painful and they're sore. But days, maybe weeks later, that dog will start to improve. And so they'll start to allow it to go out on walks more. And unfortunately, I do see many owners that will bring their dogs to me at that point, they'll have suddenly gone downhill. And they'll say, well, no, we did have a problem a few weeks ago. We gave some medication, seemed much better. We went out for a walk yesterday and bang, the problem has suddenly worsened. So when we're doing rest, we do need to do at least 4 to 6 weeks of rest. And there's a really good rationale for that. It's the ligament. Going back to the donut, the ligament has torn and that needs to repair, because if we don't allow that to repair, there's a big hole where the jam's going to be able to leak out. So we want to rest this dog for 4 to 6 weeks. That's how long a ligament takes to heal. And then we're fine to go from there. So that's the reason for it. And it's why catching these dogs early is great. But I do want to say there are those owners that never have that opportunity. So just because you might be listening to this thing, well, that's not what happened with my Dachshund. And unfortunately, that is true, because when discs go, they can go very dramatically as well. So hopefully, if it were to happen to your dogs, you're one of the lucky ones, I guess, that has just the pain signs and you can manage it conservatively. But if you do see that dramatic deterioration, that's when, emergency surgery is probably your best bet to get that dog back to full health.
I'm going to push you on one thing. So you said 4 to 6 weeks. Is there a rationale behind whether it's 4 weeks, whether it's 6 weeks? What is the rationale there?
No, really, really good. And I am vague with it because I think everyone would give different advice. And I don't think it would be fair to me to say one answer is right. Personally, I would say if it's pain, I would be quite happy with 4 weeks, provided the dog has improved a good time within that 4-week window. So if I'm resting the dog and a week in, the dog's already almost back to normal, I'm like, well, great, please don't walk your dog yet. Wait that 3 more weeks and then go. Whereas if you're getting to the end of the 4 weeks and we've still got problems, say we've got some drunken walking, we've maybe still got pain, I would go to 6 weeks. But the 4 to 6 week window is simply based on what we know about ligaments healing. And that's the window of time that ligaments take to heal. Obviously, the ligament's not fully ruptured in that it's not like in a limb, ligaments tie one bone to another. So it's not like it's a full rupture in that way, because that would be devastating. I'm not an orthopedic surgeon, but that wouldn't be great. But this is a torn ligament where the rest of it is all together. So hopefully it just allows that to heal up in that window of time.
I'd love to move on to practical advice. I know we've kind of covered it a little bit, but particularly for anyone who has or is considering getting a Dachshund or any other dwarf breed, to help them be as prepared as possible. What factors can help owners decide if rest or surgery is the best course?
So this is something where we want to really look at the severity, and I think that's vital. When we have a dog with IVDD, we want to know how badly affected is that dog. Now, this is where grading comes in. And grading it's a shared language, if you like, between the vets and the owners. It's a 5-grade system. It's not perfect, but it's practical, and it's widely understood and incredibly useful. So it tells us where the dog sits on a neurological scale. So sort of pain through to the drunkenness, through to an inability to walk, then complete paralysis, and then what we call loss of deep pain. So grading's not about giving the dog a label, but it's about trying to find out where they are on that risk scale. So grade 1 is the mildest. So grade 1 is pain only. The dog can walk normally, but the spine hurts. So that's where you're getting maybe occasional yelping, they're guarding their back, they're trembling, refusing stairs, and that sort of thing. Then we go to grade 2, where dogs become a bit drunk, and they're sort of wobbly and weak. They can kind of walk, but they're struggling. Now, those 2 grades, grade 1 and 2, I think it's very reasonable when you have a dog in those grades that we actually can go down either the route of conservative management or surgery. And I'll come back to that in a minute. But at those grades, things are looking good. And I think either management is appropriate. But then we get to grade 3. Now, grade 3 is really the dog that can move their legs, but they just can't walk without help. So they're non-ambulatory is how I'd refer to them. So there's good movement there, but it's just not useful enough to take a series of independent steps. Grade 4 is when you've really completely lost all movement to your back legs, so true paralysis. Now at grade 4, these dogs still have pain sensation. So when your vet checks for pain, they'll sort of pinch the toes, maybe with their fingers. I mean, sometimes we do need to use something more firm to see if there's pain there. But we're really looking to see if the pain message is still travelling all the way up the spinal cord and being recognised by the brain. So this is what we often call deep pain. And it's one of the most important signs we use when judging prognosis. So if you've still got deep pain, you're grade 4. But then it moves to grade 5, which is the most severe. And this is paralysis, so no movement, but also no deep pain perception. So when we pinch the toe, this means the dog's completely not able to respond. So the signals just aren't getting through. Now, it doesn't mean the spinal cord has been chopped in two, but it does mean we can't demonstrate that that painful message is getting from the injury up to the brain. And it's really, this is a big mistake a lot of people make, and I know vets struggle with this too, but deep pain's not a reflex. It's the brain receiving a message. So I always say it's not a good thing for an owner to try at home, because if you see a leg pulling away or a toe twitching or even some tail movement, that can be a bit misleading. And much of these responses are reflexes, and they can still occur even with the most severe spinal cord injuries. But the grading matters because it guides urgency, treatment and prognosis. And if you've got a dog that's grade 4 or grade 5, the traditional figures suggest that maybe Surgery, you can have a chance of, well, if you have deep pain sensation, there's a chance of 80 to 90% of recovery with surgery. Whereas if you've lost deep pain sensation, provided it's gone in the last 12 hours, you're looking at a chance of about 50% chance of recovery. So you can imagine owners with dogs with grade 5 are much more severely affected and really are facing, we call it a blue light emergency. It's one where we need to get that dog into theatre and operate as soon as possible. And unfortunately, owners do need to commit to that surgery without knowing if those dogs are going to get better. And that's a tough thing, especially when it's happened suddenly. The final thing to add to all this is what people don't talk about. So if you're resting a dog or you're operating on a dog, people don't talk about relapse rates. And I think that's really important because I've said already, if we operate on a dog, they've got a 1 in 10 chance of relapsing in the future. And I honestly think that's probably a lower stat than that. So surgery kind of does fix the problem from happening again in the majority of cases. But if we conservatively manage, so if we go down the route of rest without surgery, at least half those dogs can go on and relapse. So sometimes in some dogs, it's almost like kicking a can down the road that you have fixed the immediate problem, but actually it could come back months or years later. And then it could come back worse. I mean, you might have a dog that was grade 1, just painful. They might be rested, they do well, they run around, but then 3 to 6 months later, they might present again as a grade 5 dog, which is the blue light emergency that needs surgery. So these are things that are important to understand when making the decision on how to manage your dog with IVDD.
We've mentioned some earlier, but can we go over some of the early warning signs that your dog is in grade 1?
Yeah, so the most common sign I think we see is dogs that look like they've got abdominal pain, tummy pain. So it can be as simple as a little bit of sickness, maybe one-off vomiting, or a little bit of diarrhea and not wanting to eat food. Now, I don't want anyone that sees that in the Dachshund to immediately think, oh, it's got IVDD, because that is obviously a very broad type of sign and can happen in so many different conditions. I mean, I think between us, we could list so many conditions that would cause that. But that's the early sign. And I think if you see that, it's something just have in the back of your mind, could this be IVDD? But then you'll start to notice some mobility changes. And they're things like not wanting to run, not wanting to jump. I mean, Dachshunds are small, so, sometimes they might struggle to get over the step into the house, that kind of thing. And I've often seen that as one of the first signs that they've gone for their walk okay. They're a bit slower than normal, but they get home and they can't just get over the threshold into the hallway. That can be a really clear sign of this. And a big one for me is the yelping. A dog can yelp either when picked up, and that's common. You'll just pick up a dog and they'll suddenly yelp and you'll think, well, that's unusual, but you'll always blame yourself. That's the normal thing. You think, well, maybe it's the way I did it. And it could be, but actually we're all used to picking up our dogs unless we've got Great Danes. And then, so we're familiar with it and we can do it well. So yelping is an important one. And even more important is when you get yelping where you haven't gone near the dog. So they spontaneously yelp. That for me is a big, big alarm that there's something causing neurological pain, most likely spinal pain. And depending on the breed, IVDD is right up there as a possibility. So they're the kind of early signs I'd be looking for.
The yelp with no explained reason is probably my number one go-to as well, to be honest with you. I see that very often. And, people explain and share that there's just something not right and they've had this one episode of yelp, and my thoughts are definitely neurological in that sense. So that's really good to have that confirmed. Can breeders do anything to help reduce the risk of IVDD in pups?
Yeah, and I think this is another thing that would be really, really important to talk about, because I don't think the word's out there enough about this, but we are able to perform screening for Dachshunds with IVDD. Now, I'd want to be very clear, first of all, and say this is only Dachshunds at the moment, and hopefully it'll extend out to other breeds. But IVDD screening, it's radiographic screening for disc calcification in Dachshunds. So earlier I described the disc as a jammed donut, and in a healthy disc, the centre's soft and squidgy. But as the disc degenerates, that soft centre gradually dries out and becomes harder. Now, eventually it becomes mineralised or calcified, and then that jam sort of slowly turns into this grit. Now, it's that calcified grit. It's one of the hallmarks of advanced disc degeneration, and it tells us that disc is much more likely to rupture in the future. Now, the idea behind screening, so radiographic screening, is really simple because Dachshunds with a high number of calcified discs on spinal radiographs as young adults have a much higher risk of developing a disc extrusion, so IVDD, later in life. In other words, the more calcified discs a young Dachshund has, the greater the risk of IVDD. Now, radiographs can pick up these calcified discs. So I said earlier, X-rays aren't great at this, but in this circumstance, X-rays are very good at picking up the calcifications. And there's a UK IVDD screening programme, and it's really important because it builds on schemes that have operated successfully in the Nordic countries for many years. They've done a great job at reducing the risk of disc disease. Dogs are X-rayed between the age of 2 and 4 years. So if you are a breeder with a Dachshund between the age of 2 and 4, that's when we need to be doing this. And the number of calcified discs is counted, and that's then used to guide breeding decisions. It doesn't eliminate the risk of IVDD, but it's one of the most powerful tools we have. And if you are thinking of getting a Dachshund puppy, a really useful thing you can do is there's a publicly available register of the screened Dachshunds in the UK. So if you're thinking of buying a puppy, you can look at the parents and see whether they've been screened and what their IVDD score is. And it's one of the few opportunities that owners have to reduce the risk before they even bring a puppy home. So it's got lots of benefits, this. And the grading, they're graded to 3. There's grade 0, grade 1, grade 2, and grade 3, with grade 0 being no calcified discs. I'd want to be very clear that it's very unusual to get a Dachshund between the age of 2 and 4 with no calcified discs. So please don't be worried if they're a grade 1 or even a grade 2, but it's who they've bred with. So we want higher risk dogs to be bred with lower risk dogs, so we kind of bring down the risk over time. And it's enormously helpful. It's definitely what I'd recommend both breeders and owners to look at.
That's extremely helpful. I wasn't aware of that myself, so it's something that I can definitely start offering in my practice as well. So thank you for that. Final question. What is the one thing you want owners and caregivers to take away from this discussion about IVDD?
Well, so when you hear the word slip disc, I want you to take away the fact that IVDD is not one simple thing. It's genetics, disc aging, it's the jam donut leakage. You get spinal cord bruising, so it's not just compression. You get pain, inflammation, but we do get recovery. Recurrence is a risk, and there are techniques out there to try and prevent it. And I could go on, but the art is working out which part of that story the dog is living with today. And that's why IVDD needs both urgency and nuance. So urgency, because a dog in pain or a dog that's drunk in its appearance or unable to walk really needs help quickly. But nuance, because the scan, the grade, the dog, the owner, the timing, and the biology of this all matter. And I think right at the beginning, I said that IVDD it's not just a slip disc. There's so much that goes on in there to kind of get your head round. And every dog is different. So the advice I might give one person with a dog with IVDD could be completely different to another owner. And it depends on all of these factors, and not least that owner's position and where they sit in terms of how they want to approach this condition. So don't hear IVDD and panic and run the other way. There is a lot of discussion to be had should you be unfortunate enough to have a dog with this condition.
Thank you so much, Mark. There was so much value in there, and thank you again.
No worries. Thanks for your time.
Thank you for joining us. I'm your host, Fabian Rivers, and this podcast is brought to you by Petgevity. If you'd like to find out more about how we can help your pet live a longer and healthier life, the link is in the show notes. This podcast is produced by Flamingo Media. Thanks, and see you next time.